What is Medicare? What do you do before you turn 65? What do you do once you turn 65 but you're still working? And what about that group insurance that you have with your employer? If you take Medicare and you're still working, what happens to that group insurance? So agents sometimes make this process complicated, you know, and people get confused and then they don't know what plan to choose, uh, what's going to happen to the future. As you turn 65, you know, a lot of times your health starts declining. If you're healthy, it's okay, it's great. You're still going to need Medicare. So either way, you're going to have to understand going forward what's going to happen to your health care, right? So let's get into it. My name is Maribel. I've been a licensed insurance agent for life and health, and I love doing Medicare. I really do enjoy it, and I do life insurance as well. But this channel is specifically for Medicare. I've been licensed since 2018, so it's been a while, not 20, 30 years, but it's been a while, and I've learned a lot about Medicare. So we're going to be talking about all those points and a little more. So let's get started. Get a tea, get your favorite drink, you know, whatever you want to drink. I got my coffee because it's in the morning. And so let's get right into it. Now, you may want to grab a pen and paper because you may want to write some points down that I'm going to say. If not, you can pause the video, you can make some comments on it and ask some questions about it, and I'll go ahead and reply to it, okay? So the first thing we're going to talk about, and I made some notes, and you're going to be kind of see me glance a little bit on my laptop because I made some notes because I love to talk. And I'm going to get into the whole process, and I may forget some points that are critical for you to understand. So I made some notes, and I'm going to go point by point so you can understand it in a simple way. Okay? All right, let's get into it. So what is Medicare? Medicare basically is a federal insurance healthcare program, right? And it covers everybody from 65 and up, unless you have a disability. For example, ALS. Not every disability is accepted by Medicare. So Medicare would have to approve you, right? And Medicare usually covers the healthcare costs of all expenses, you know. Sometimes not all expenses, okay, but most of it. Now, Medicare has different parts, so there are plans that you can choose from to combine with Medicare, right? So Medicare will cover 80%, then the 20% will be covered by whatever plan you choose. Now, Medicare has different parts, A, B, C, not the ABCs, but it's A, B, C, and D, you know, that's what it has. For example, original Medicare is part A and B, right? The red, white, and blue card that you get is when you get 65, it's going to show you the day that part A and B is effective, okay? So if you're still working under an employer, for example, you're probably going to have to choose between the group insurance and the medical part of Medicare, which is part B. Okay? So A is for the hospital, B is for doctors, C is what they call those HMO PPO plans from either Carrier, United, Humana, Cigna. There's thousands of them, depending on what state you're from and what carriers are there. Okay, so there's just too many of them. Now, then you have supplemental insurance. Some people call these plans that I just mentioned supplemental. They're not. The Medicare term is just HMO and PPO plans. Okay, supplemental plans, it's something very different. It's NGF, all those plans, and we'll talk about those on another video that I'm going to be making. Okay, those are for different coverages and different situations. Okay, just very, very different. Now, when you get your part A, let me back up a little bit. So before you turn 65, what do you want to do, right? So before you turn 65, about 3 months before, you're going to request your Medicare because you have 3 months prior your month of your birthday and 3 months after. Okay, so 3 months prior your birthday month, you can request your Medicare card, which in essence is Medicare, and you're going to have your Part A. You have the option to have your Part B, which is medical, right? Your Part A is going to be everything that is in the hospital situation, kind of inpatient care, everything that's done inpatient care at the hospital, okay? And then B, it's going to be your medical part, which is everything that's done at a medical facility like the doctor's office, outpatient, okay? If you go do a test, that's going to be covered by Part B. If you do an outpatient procedure, that's Part B. Unless you stay overnight at the hospital, that'll be Part A. Understand? Durable equipment, things like that is Part B. Now, if you are still working and you have a good insurance coverage at work and you want to keep it, right? Because you like it, it's good. You don't pay that a lot. You're not going to pay the $206 that is now the Part B, okay? That you're going to be paying either out of pocket if you're still working, not receiving your Social Security check. If you are receiving your Social Security check, then you could have it deducted from there. Whether you're working or not, you can get your check. If you do get your check, then you can have that premium for Part B deducted from that check. If you're not receiving that check because you're still working and you want to hold off that check until later on in late 60s, you have the max until 70 years old, okay? That's the max that you can hold it. Now, if you don't receive that check and you are still working under a group insurance, you don't have to get Part B, okay? You can just get Part A. You do have to get Part A. You have to at 65, okay? Now, make sure that you keep that group insurance, if you're happy with it, until you're ready to switch to Medicare Part B and so on. Why? Because if you ever let go of that group insurance and you're healthy, and then you say, well, I'm healthy, I don't need any medications, I don't need group insurance, I'm going to save that money, and I'm not going to pay Part B because, I'm going to save that money too, I'm healthy. Not good. Because the day that you're going to get that Part B, you have to get your prescription drug plan, which is the the Part D. Okay? And I'm going to go back and make some points. Bottom line is that Part D, which is for drug coverage, is mandatory. So once you get your Part B for medical, because you're not going to be using your group insurance, okay, then you have to get your Part D for drugs. It's mandatory. Okay? If not, you're going to get a penalty. The penalty is not millions of dollars, but it's added to your premium of whatever plan you get going forward into the end of life. It doesn't drop off. Okay, I want to make that clear. It doesn't drop off. You can appeal it, and hopefully you can win, but it doesn't drop off. So, let's go back. Part A is going to be your hospital coverage, anything inpatient. Your Part B is going to be your outpatient medical equipment, like durable equipment, like wheelchairs, oxygen tanks, outpatient procedures, things like that. That's Part B. Part A also covers skilled illness facility, like long-term care, nursing home, things like that. That's Part A, because it's inpatient. Once you have A and B, right, because you retire, you no longer have the group insurance, you no longer work, or you work and you don't want that group insurance anymore. That's when you get Part A and B. Okay? So now you have A and B. Now you're required to have Part D. D as in drugs. You have to, even if you don't take any medications. If you don't, you're going to get a penalty the day that you put it on for all those months that you didn't have it. It's a little percent of whatever that year, because it's an equation. Every year they give a special number, and it's a percent of that number, right? The average premium. What happens is that little percent gets added to whatever premium you have on whatever plan you get. So A and B cover about 80%, let's say, 80% of all the cost. What people get at Part C, which is the HMO and the PPO plans, is to cover whatever Medicare doesn't cover and have extra benefits, right? So those plans, sometimes they come also with the drug coverage. So you're good. Now you have A, B, and you have the C with a drug coverage. You have a plan, an HMO or a PPO of your choice that's available in your area that coverage drugs. So you're safe. No penalties, no anything. Okay? If you have a plan, Plan C, if you have a plan that does not have drug coverage, you have to get Part D that has drug coverage. Either way you want to have it is fine, but you have to have the Part D. Make sense? All right. So one thing that I do want to make sure that I talk about is, let's say the 3 months before you turn 65, right? This is like the order that I want you to kind of go about it. You apply for the Medicare A, you can get B if you need it, and then you search for a Part C, that coverage, that has coverage for drugs. That's what you got to do. Okay? And that's basically what Medicare is. In another video, we're going to be talking about what other different plans are there. I'm going to make another video right after that is going to be specifically for the process, the steps that I want you to take from before 65 into you are on a plan. Okay? Now I just wanted you to know what really is Medicare. Okay? So we got that clear. A, hospital. B, doctors and outpatient. A, hospital, inpatient. B, doctors, outpatient, procedures. C is going to be plans, HMO or PPO, with drug coverage or not. If not, then you're going to need Part D, which is covers the drugs. It is mandatory. I want you to be clear that you understand that. Avoid that penalty because you're not going to be able to take it away later. Okay? I hope this makes some sense. I hope this kind of made things a little bit clearer for a lot of people that are very confused. I have clients that when I speak to them, they just don't understand it. They just simply don't understand it. And their HR department don't even explain it to them because they don't know. They don't really know. They know the benefits that they offer to you at work, but they don't know what Medicare does. Okay? And when you call Medicare directly, they might even confuse things for you. Okay? So any comments, any help that I can offer, feel free to reach out and I'll be happy to help you. All right? Thank you for watching and I'll see you on the next video.